lovemaking. AC moms are not incorrect here. Google is information and misinformation.
Wow, I've learned something today.
Hi there, I'm Dr. Biju Singh and I'm a gynecologist. I'll be answering some questions related to gynecology which have been put up with Kofuku, and I'm very happy to answer all of them.
26 female. What's a birth control that won't make me fat, depressed, or 300 times hornier than my boyfriend? Asking for a friend.
What's a drink that doesn't really make you drink so much that you're knocked out of your senses, but you're still in your senses and you're having fun? I think it's very difficult to have the ideal oral contraceptive pill. Some do make you bloat up, some actually help you lose weight, some sort out your mood. Now, does the pill make you hornier? In 85% of cases, no. It doesn't really increase your libido. The increase in libido could probably be one, due to the estrogen component. Two, it could be also because you now know that you're not going to get pregnant, you have protection, so you become more, should I say, bolder in your intimacy. So there might be other factors related, but per se, contraceptive pills don't really increase your libido.
24F. Does pulling out actually work, or are we all just in denial?
So pulling out is an old technique from the yesteryears, and our forefathers actually practiced it. I think it's all about lovemaking. If you really look at the pull-out, which is known as coitus interruptus, you're interrupting coitus. The failure rate is pretty high. It's about 20 to 22%. Now, if you compare that to contraceptive pills, which have a 99% success rate, means you have a 1% failure rate. So 22 to 20% is pretty high. We don't generally recommend that. It's very important for people to know that before the ejaculation itself, there's the pre-ejaculatory fluid, and that also can contain sperms. So you might not have ejaculated inside, but in the excitement phase, when you're having that little secretion, that itself might cause your partner to get pregnant. So we don't really recommend that, but if you have nothing around you and, well, you're in the mood, well, you can take your chance.
My mom said birth control causes cancer, so now I'm spiraling. Someone please debunk this.
So birth control does contain estrogen and progestogen. So what we're worried about is the estrogen component. So there are certain things that we ask our patient, such as history of breast cancer, liver disorders, whether you have thrombus formation, whether you're a smoker. So these people are in the high risk category. So definitely if you have a family history of breast cancer or any ovarian, uterine cancer, we do recommend that the oral contraceptive pill should be avoided.
How do you know if it's a UTI or yeast infection? I'm too scared to Google it again.
So Google is information and misinformation. We would say that these are two different symptomologies, but definitely they're neighbors. So if Canada sneezes, then America catches the cold. So similarly, the unibladder is very near to the vagina. So when you have the UTI, you generally have urinary symptoms where you are passing urine frequently, there's burning, you might have nausea, vomiting. Whereas a yeast infection, you'll have a curdy white sort of discharge, and there's more of itching, and there's more of burning inside the vagina. Whereas in a UTI, you'll have more of burning in the urinary passage. So they're a little different. They're nearby, but they could overlap. A simple urine routine and culture will tell you whether you have a urinary tract infection. As far as the yeast infection is concerned, probably you need a physical examination. We can even test the vaginal discharge. The look of it itself tells us a lot about whether it's a yeast infection or you're having a urinary sort of pathology.
20F. When are you supposed to get a pap smear? Is it like a birthday thing, or when you start having sex, or what? LOL, hell.
I think the answer would be when you actually first start being sexually active. Now, defining an age would be a little difficult because in our country, we assume our girls are sexually active a little later compared to probably the Western world. But putting a safe number maybe at the age of 21, 22, that may be a good time to start doing a pap smear. And that probably goes on till you're about 30, 35. So that would be probably on a 2-yearly basis. And once you're 35 to 60, maybe you can do it on a 3-yearly basis. And we do what is also called a HPV testing. The HPV is the human papilloma virus testing, and if you're negative for that, then you don't really have to test for 5 years. And once you cross 65, if your pap smears have been normal in the past, then you probably don't have to do it. It's a very simple thing, not really painful, and I would recommend it. So guys, thanks for watching, and if you have any further queries and you want your queries to be answered in an authentic, professional way, then please log on to Kofuku. That's where all your questions will be answered in the correct way and in the right way and in a very informative way.